In today's Eye on Health, a COVID update. So many people have questions about COVID-19 headed into 2022, and we have the answers for you today. Dr. Timothy Law, he's the Medical Director for Clinical Services at Highmark. Good morning, Dr. Law.
Good morning.
Yeah, I know there's a lot of information out there about COVID-19. What's the current state of the disease?
Well, I think the current state is after the holidays, we have a large influx of cases in both our communities and hospital systems. And so things happen to be increasing from the increase in the Omicron variant as well as still. So I think after the holidays, we saw a significant increase in COVID cases, not only due to the increase in the Omicron variant, but also an increase in travel over the holidays where people were being exposed to each other in airports, homes, and other gatherings for the holidays.
Yeah, that's right. And I have to say, all I hear now is Omicron. Whatever happened to the Delta variant? Is it still there?
Oh, yes, the Delta variant is still there. Omicron happens to be the thing of the day today for the variants, but Delta variant is still out there, still just as deadly as it was before, and we have to make sure we're watching both of those.
Yeah, and I know so many people that have become infected with the Omicron variant. How do you tell the difference between Omicron and Delta? Are the symptoms different?
Well, the symptoms are very similar as far as the normal headache, sore throat, fevers, congestion, cough, that kind of thing. One of the interesting facts of Omicron variant is it doesn't seem to have the loss of taste and smell like before. So in the past, people used to say, oh, I lost my smell, so I know I have COVID, I don't have to go get a test. That's no longer true. If you have the symptoms, you should contact your physician, talk about what your symptoms are, and see what the best course of action for you is before proceeding.
Yeah, and at this point, how important is the COVID vaccine?
Still very important. Although you may hear cases of people that had the vaccine and they still get the virus, the point of the vaccine is so that you get less sick and less severe and have to go in the hospital less, so you're not taxing the system so much. So you should definitely still get the vaccine, get the boosters that have come out, and continue to protect yourself and those around you.
Okay, so still get the vaccine. All right.
Definitely.
And so in addition to the vaccine, what are some other precautions you can take to make sure that you don't get COVID?
Sure. Well, with any viral respiratory illness, you should definitely strict hand washing. Masking is still an important aspect of life. They should be properly fitted masks, and there should be the right type of mask. You should still practice social distancing when necessary. So if you're sick, you have a fever, cold, symptoms, that kind of stuff, you should stay home. In large crowds, try to stay away from those people that around you with the social distancing. And then, of course, as we mentioned earlier, get the vaccine if you're in a category that should have the vaccine.
Yeah, speaking of staying at home, has the recommendation for the time you should quarantine changed?
Yeah, the CDC has redone their guidelines a few times now, and at this point, we're at about 5 days. But beyond what the CDC says, if you're sick, no longer is the point of saying, hey, they're a real trooper, they went to work even though they were sick. So if you're fever and you have colds and symptoms, you should stay home. You should protect yourself, you should protect those around you, and you should protect those people that you don't know around you. So yeah, stay home. If you have a positive test, the CDC recommendation is to stay home for 5 days until you have a negative test.
Yeah, really good points there. And I know the hospital systems are completely overwhelmed, especially coming out of the holidays. So what should you do if you suspect that you have COVID-19?
Well, rather than just run straight to the hospital, because we are overrun, not only with number of cases, but also with lack of staff. So you might have a hospital that has 500 beds, but only 300 have enough staff to cover them. So that means they have 200 beds they can't even utilize because of that. So don't just go straight to the hospital with symptoms. Call your physician, and based on your own current medical problems, your physician will tell you whether or not it's something you need to come in to see a physician for or go to the emergency room.
Dr. Law, wonderful information, very helpful, and I'm sure you've helped a lot of people this morning. So thank you so much.
Thank you.
And thanks to Mikey, too. And remember to keep watching for our Eye on Health series right here on PTL. It happens on Wednesdays, and it's brought to you by Highmark, Blue Cross Blue Shield, together with Allegheny Health Network for your health.